Hi everyone, it's lovely to be here and share some information with all of you. In today's session, I'm going to be talking about acne and acne marks. Please feel free to ask any acne related questions and skin concerns that you might have. Before that, I would like to introduce myself. I'm the director of the Bombay Skin Clinic with a decade of experience in dermatology, trichology and aesthetic dermatology. My expertise includes pediatric dermatology, anti-aging, lasers, medifacials, skin rejuvenations, hair loss treatments, PRP, acne removals, stretch mark removals, and pigmentation treatment. I believe in a very holistic and a less is more approach. And personally, I love to follow up with all of my patients, closely keeping a track of their progress and the needs. Now I would like to introduce you and give a small introduction to you about my clinic. The Bombay Skin Clinic is an advanced medical facility located in the heart of South Mumbai. It provides a wide range of dermatological and aesthetic solutions. Our clinic is a very sleek, calm, spaced, equipped with international US FDA approved machines and internationally recognized products that are operated by trained technicians under my supervision. Here are some of the examples of the equipments of our facility offers. We have a US FDA approved premium high-speed lasers for painless hair reduction. We have an advanced microneedling RF technologies for acne scars, which I will talk to you later on about, and stretch mark removal. We have a US FDA approved Q-switch Nd:YAG laser, which has a revolutionary gold toning technology. We also offer a high-intensity focused ultrasound for face and body contouring and skin tightening. We use products from leading popular international brands like Obagi, Thalion, Cosmelan, etc. We also offer a lot of medifacials like pumpkin facials, like the brightening facials, like the agas facial, which are all very natural and very effective. So now I will talk to you a little bit about acne. So it's very important to know what is acne. So acne is just a very chronic inflammatory skin condition that will cause spots and pimples more commonly on the face, but they can also occur on neck, chest, back, shoulders, upper arms, and they generally start when the greasy secretions from the oil glands, they plug the tiny openings of the hair follicles, and that's called as the plugged pore. Now, if the opening is very large, the clogs can take form of blackheads, which are these small flat spots with dark centers. If the opening stays small, the clogs can become a whitehead. Now, and these are all small bumps on the skin. Both these type of plugged pores, when they develop infection, then they become into a pimple or a big lump or a nodule or a cyst. Nodules are more severe cases of acne, which are like a firm swelling on the skin surface, which become inflamed, they are tender, they are infected, they can leave behind a horrible acne scar. This all is called as acne vulgaris. So you have to realize that even a blackhead and a whitehead on your face is acne and can be treated. You don't have to have these whiteheads and blackheads with the correct creams. Now, what are the triggering factors for acne? There are following triggering factors that can precipitate an attack of acne, mainly hormonal changes. These can happen during your menstrual period, during your teenage years, if somebody is taking a birth control tablets, during pregnancy, during excessive stress, there's a hormonal change. These hormonal changes can activate your oil glands or your sebaceous glands, which in turn will give you clogged pores and acne. Then greasy, oily hair care products or cosmetic products, like if there are these compacts which you're using which have not been changed, or your puffs or your brushes which have not been washed, these all can cause acne on the face. Excessive sweating. So in the summers, if you're sweating a lot, if you're not cleansing your face well, it can clog up your pores and can cause acne. Hot, humid climate that we in Mumbai suffer from, that can cause a lot of truncal and chest and shoulder acne. Like if you're gymming, exercising, I've seen a lot of people who go to the gym and then they suffer suddenly this burst of acne on their shoulders and the chest. If you're on some medications, some medications also can aggravate acne. So we like to take a detailed history of what medicines the patient is taking, our patients are taking. And it's important to seek some medical advice. I will tell you some grades of acne. Grade 1 are blackheads and whiteheads. Grade 2 are blackheads and whiteheads and pustules. Grade 3 are pustules and few cysts. And grade 4 is pustules, a lot of pustules, cysts, sinuses, and scars. Now I'm going to show you a picture of the types of acne, right? So if you see this, if you can see, this is a healthy sebaceous gland, okay? This is a whitehead. This is a blackhead. So this is a black clogged up pore. This is a papule, which is suddenly just little bit, it has inflamed. And if you see these glands, they become bigger. This is the sebaceous gland. And this is a big pustule. So this overall is inflamed and it's tender and it needs to be treated, okay? Now, how does active acne convert to scars? In active acne, when the glands get infected, it can lead to a lot of inflammation that can lead to scar formation. This eventually will lead to a permanent scar if not treated earlier, while whiteheads and blackheads lead to open pores. Now, related to scars, I have got a question from Mr. Vijay Prasad. Hi, Mr. Vijay. His question is, I have and those have left behind scars. There are two things. Either it's an acne mark or it's an acne scar. If it's an acne scar, means it's a depression in the skin, you need to do treatments which like a derma roller or microneedling RF, because scars are nothing but a depression or a dent in the skin. And that dent in the skin is pulled by fibrous tissue bands. It's very important to break those bands so that the skin can come up and you can have a normal skin. So there are treatments like derma roller. There are treatments which we offer in our clinic also, like microneedling RF. It's a very new technology, very safe for Indian skin. It's a laser, but not really harmful for the skin at all. Now, what treatments do I suggest for active acne? We offer a very detailed examination and a treatment plan. First thing, the plan will depend upon the grade of acne and what is the root cause of acne. It's very important to treat the root cause. Then accordingly, either we suggest some investigations and then we decide whether hormonal tablets to be given, not to be given, or we prescribe a vitamin A medication. The vitamin A medication is given in our clinic with a lot of, we do a lot of, we can counsel the patients a lot. We explain to them how important it is to take it as the dose that we have prescribed and as the dose that a lot of literature studies have been done, and then they have recommended a particular dose. If you don't take the particular dose, you get back your acne. Then we also help giving topical medications to control acne. And remember, over-the-counter face washes and creams cannot help acne in a holistic way. So it's very important to take a dermatologist advice. Now I've got a question from Wasim Qureshi. Hi, Mr. Wasim. You have just messaged me saying, can you suggest a good face wash for oily skin? Now, a good face wash for an oily skin, you can pick up some cleansers or face wash cleansers which have an antimicrobial activity, but they are not they don't make your skin very dry. Because sometimes we try to use these salicylic based face washes which make the skin look very nice for a few hours, but then it causes to produce more oil in the skin. So please be careful when you actually pick up a face wash. I like the Sebamed face wash, the foam face wash. It's very nice. It's very mild. It keeps the pH of the skin controlled. So whichever face wash you use, you remember your pH of your skin has to be balanced. If it becomes too acidic or too alkaline, that aggravates acne more. I also like oatmeal based cleansers. So oatmeal has antimicrobial activity, but again, it helps to remove excess oil, but it doesn't dry the skin. So you can also pick up the Derma face wash. So it depends actually, your face wash will depend on what creams are given to you. So everything is in sync. All your products have to complement each other. It's not based on only one face wash or one cream, right? Now, what are the treatments that we suggest for removal of scars? Scars need to be treated as early as possible. If there are small pits, pores, scars on the face, they actually can be treated so well and so effortlessly, right? Basically, they're like dents in the skin. The skin is getting pulled down by your scar tissue, which causes a depression in the skin. So if there are these bands here, it's very important to break those bands so that the skin can pull up, and that will make your skin smooth, okay? There are treatments as simple as a derma roller and subcisions. Also, we do in our clinic, we always do all the treatments with a subcision and then we follow it with a treatment. We have a microneedling RF technology, which is very advanced. It basically is nothing, it helps to generate new collagen and break your scar tissues. And there's no downtime to the treatment. Patients can go home looking little red for an hour and you see the results after 2 or 3 weeks. So for really very deep scars, you suggest laser resurfacings or CO2 lasers, but these have a lot of downtime. Now, I have got a question from Mr. Avkal Yadav. I have mild dandruff, kindly suggest me a good shampoo. Okay, so we're talking about dandruff, but I would like to answer your question. If you have mild dandruff, there are a lot of over-the-counter dandruff shampoos. They're not really that effective. They make you feel very good for a day. The next day, you're back to the same problem. What I suggest is you could use something like a SLS-free, a paraben-free, a chemical-free shampoo, which SIBO regulates your scalp. So it doesn't make you very dry. It doesn't make you very oily. So there are many new ones have come. Even Sebamed has an anti-dandruff shampoo. There's a Faultine sebum shampoo. Then there are these argan oil shampoos, Moroccan shampoos. So you can use one of these shampoos and then once a week you can complement it with a dedicated anti-dandruff shampoo like a ketoconazole based or a ketoconazole based shampoo. So how do you use it is very important. You wash your hair with your normal shampoo, which is a soap-free shampoo, and then you use the anti-dandruff shampoo in your scalp, leave it only for 5 minutes and wash it off. You cannot use a medicated dandruff shampoo as your base shampoo. So that will keep your scalp less dandruff and it will not make your hair very dry. Okay. I've got a question from Mr. Nitesh. Hi, Mr. Nitesh. The question is, can you suggest a good skin lightening cream after for treatment for long use? Now, there are a lot of treatments, creams, lightening creams available, which are triple combination creams that we call, like they're steroid-based, hydroquinone-based, and a retinoid-based. These creams are to be under supervision by a dermatologist and to be used only for a specific period of time, like for a week or 2 weeks or 3 weeks. You have to then switch to a more gentler, a more less harmful cream on the face, like a lightening cream, which have kojic acid or mandelic acid, or even like a vitamin C based cream. So like vitamin C is really very important to start. Start with a vitamin C base. It has an antioxidant quality. It has a brightening quality. It has an anti-aging quality. So a good vitamin C serum is what you should invest in if you want a long-term period of good skin and a bright skin. Now, if I come back to my acne, what are the types of acne scars? There are some box scars, rolling scars, ice pick scars. Now, the ice pick scars, when a patient comes to my clinic and if I see all these scars and then if I'm seeing that there are no ice pick scars, I feel really relieved because ice pick scars are very difficult to treat. Now, the best way to find out if the scar will improve, it's a very simple test. You can actually stand near your mirror, opposite your mirror, and you can do it yourself. And we actually show it to our patients. What we do, we stretch the skin. When the skin stretches and if your scar disappears, then it's an indication that the scar will improve with the treatment. At that point, we can actually tell our patients an exact percentage that your scars will improve. And that really makes our patients happy too. There are some peels which can be offered for acne. Like there are certain peels that if a patient comes to me with an active acne, I would first like to treat the active acne. So we do treatments with salicylic acid peels, glycolic acid peels, and azelaic acid peels. Now my most favorite and the newer peel, which is a black peel, which is made from black vinegar. And it's an organic peel. It's a mixture of salicylic acid and jasmonic acid. So it's very safe and it has been proved to improve various skin problems like active acne and helps to prevent acne marks. The black treatment which is offered in our black peel treatment which is offered in our clinic is a 30 minutes procedure, no downtime. It immediately helps to settle active acne. I have patients who come and do a spot acne peel, like if the next day they have an important event or a meeting, they come the next previous day, they do the treatment, the acne gets cured, it gets subsided. We also follow an anti-acne program. This is a program designed by me. It's a comprehensive program which includes a combination of treatments. We do a carbon laser peel. After that, we do a gold toning, and then we complement it with a peel. It usually takes 6 to 8. It is a 6 to 8 step treatment. And what are we doing basically? We are helping to clean the sebaceous glands, and which helps to immediately reduce the acne and acne marks. And according to the severity, we can ask the patients to do the 2 or 4 sessions. So like if I can show you this is my skin model. This is your oil gland, right? So this is the problem. So the treatments and all will help to clean these oil glands, so that then whatever creams you apply here will be effective. If the oil gland is very blocked, no creams or no over-the-counter creams or face washes can help. So that's what we try to explain to our patients, right? Now, I have a treatment from Mr. Nikunj Tyagi. I have a scar on the head and what should I do about it? So it depends what kind of scar. Is it a chickenpox scar? Is it a surgical scar? Or it's an acne scar? If it's an acne scar or a surgical scar, they can respond with scar therapies like what I said before. Scars are basically dents in the skin. We have to lift those dents up. We have to break the collagen, the scar tissues which are pulling your skin down so that the skin can come up and your normal skin. So it has to be done with any treatments like derma roller, again, my favorite, subcisions to break the scars, we subcise it, or microneedling RF technology, or laser resurfacing, any of the above. But you have to meet a dermatologist to exactly explain you the plan for your scar on your forehead, on your head. I have the next question from Mr. Avinash Kumar. He's saying his brother is 14 years old and having too much acne on his face near the nose area. So if he's 14 years old, means he's in the puberty age group. So his oil glands are active because that's a hormonal change that you go through. So if there are only very few acne on the face, then he can be given a good face wash, a cream to be applied every night, or he can come and do a treatment to first clear up those acne, and then he can maintain himself with the cream. If the acne is very severe and he's been having a lot of big boils and cysts and pustules on all over his face, then he should meet a dermatologist. There are medications that you can start on. There is I'm just trying to make people aware here, taking antibiotics for acne for a long period of time helps you to settle acne for some time, but it's making you resistant to these antibiotics. So it's very important to understand that applying clindamycin or erythromycin all the time does not help the acne. It only helps the infection on top. It's not treating your acne glands. So it's important to treat those glands. And for that, there are medications which can be taken under the supervision of a dermatologist. I hope I've answered your question. There's another question from Shrishti Bedi. What is better for acne scar? Scarlet and fractional laser. So now scarlet is basically microneedling RF, and fractional lasers are ablative. So they are minimally ablative on the skin. So now it again depends on what type of scars you have. If you have a very deep scar, rolling scars, box scars, you can do scarlet. If you have open pores, you can do fractional laser. Actually, both are very effective and both can show good results. But my favorite is the microneedling RF, because what I feel is that if you break the bands and you generate radio frequency energy, it breaks the bands, stimulates collagen, and helps your scars the best. My next question is from Mr. Goswami. My nephew is 3 years old and he's suffering from dandruff. Isn't it very early for him? So if your nephew is only 3 years old, small children also suffer from dandruff. It's called as seborrheic dermatitis. So it is basically the glands on the scalp are active. So the best way to treat such a small child is don't give very hot shower on the head. We try to think that, the small baby will get cold if you give very cold water shower. Keep the water normal or lukewarm. If you put a little bit, even warm water on his head, it's stimulating his glands, and that's what he's getting more seborrheic dermatitis. So try to use normal water on his scalp. Try to use a little bit of SLS and paraben-free shampoo, like a baby shampoo for kids. And you can also use an anti-dandruff, like a ketoconazole, very little bit for him on his scalp, like once a week to help him. But I think the most important for small kids is how you wash their hair, how you wipe their hair. So, don't you want to make his hair very dry because you don't want him to get cold. So, we take the towel and we just scrub. Avoid doing that. That also stimulates the oil glands. Gently dab his head, his scalp. These small things actually help a lot more than constantly using a cream. That's what I believe in. So I like to give these small tips to my patients, right? So what face washes and how many times you have to wash yourself for acne is, as I had explained earlier, face washes alone cannot help acne. It acts adjuvant with the cream. So if it can help to remove the clean, keep the skin clean and the dirt. But a face wash should not be very harsh, and it should not reduce the oil so aggressively that it can leave the skin very dry and irritated. So a correct cleanser should be used, which is neither too dry or too hydrating. My favorite can be like an oatmeal-based cleanser. Now, after talking so much about acne, what I always like to give a small tip to my patients for natural remedies. So what are the natural remedies for acne which I follow in my clinic? There is this clay, red clay, which is a French clay. It's very it's easily available at an organic market or in a supermarket. Basically, what does it do? It's very good at drawing oil and dirt from the skin. So it's very good for oily skin. So if you have an oily skin, take the red clay, mix some honey, mix some aloe vera and apply on the face. So what it does, it helps to actually remove the oil and dirt from the skin. So it can be used once a week, twice a week. It's very natural. It removes the oil, but it doesn't make you very dry. The only thing you have to be careful is that it tends to stain your clothes. So try to wear some old t-shirt when you put this mask on your face. Some patients tell me, why can't we not put aloe vera gel? And when they put the aloe vera gel and then they use this degreasing face wash, they suddenly feel very dry. So what I try to explain to my patients is that aloe vera is a very nice anti-inflammatory, moisturizing. It has so many qualities. But it's very important, where is your source of aloe vera from? Is it natural? Is it got alcohol in it? Is it 100% organic, natural? So I tell my patients, get your own aloe vera plant, remove the seed, remove the leaf. There are so many YouTube videos which show you how to actually remove your aloe vera from your plant. And then scrub it on your face and leave it on for 10 minutes and wash it off. After using the aloe vera, it's important even then to use like a moisturizer or like not a very greasy moisturizer, but an acne control, oil control based moisturizer, because after you clean your skin, you need to hydrate your face again also. So I have got a question from some lady Sawan. Hello doctor, I do regular face cleanup at salon every month. Still I get blackheads and whiteheads. Kindly suggest what I can do to reduce the occurrence of the same. Hi Samriddhi. So by doing facials, if they're doing a lot of steam, if they're doing a lot of digging up of the blackheads, whiteheads, what it does is that it cleanses you for a day or two, but then you get it back, because as I explained to you that, sorry to show this again, but if this is your healthy acne gland, this is your whitehead. So they are just removing this, but again the oil glands are coming up and it's forming a whitehead and a blackhead. So they are not treating this, they are just helping you to remove this. So what you need to do is treat your glands, okay? So that's possible by avoid, first of all, doing any facials in the salon which have a lot of steam. Don't use a steam. You use like a little bit of exfoliating they can do, or scrubs maybe on the face. And how to prevent these acne and whiteheads and blackheads to come back is to use a cream on the face every night. So like a retinoic based cream, or a retinoid based cream, or a glycolic acid based cream. So what they will do is they will prevent the clogging up of the pores. So if you get a facial done, it's also very important to complement it with a skincare routine plan. That's what I want you to explain to my patients, that it's not only a treatment done once a month. It's the care you take of your skin every day which helps your skin. I got a question from Mr. Harjeet. In summers, there's a lot of dark spots on my facial skin. Please suggest what I do. Hi, Mr. Harjeet. So first of all, if you have dark spots on the face, or you are prone to get dark spots on the face, sunscreen. You have to use a good sunscreen. So sunscreen, SPF 50, SPF 30, a gel-based sunscreens, a cream-based sunscreens, a sunscreen which suits you, a sunscreen which you like to use, which you enjoy using, because it doesn't make you too greasy or too dry. Try to find the best sunscreen for yourself and reapply. So the important tip here is to reapply your sunscreen. Use it once at 10 o'clock, 9 o'clock, once at 12 o'clock and 3 o'clock. At least in this heat, it's very hot. And then in the summer, I tell my patients to stay away from a lot of retinol-based creams and stick to a vitamin C cream. So apply a vitamin C cream. Other creams for your specific dark spots, you can apply a kojic acid-based creams. And treatments, of course. Try to do some laser treatments. There are these laser brightening treatments like Q-switch lasers. Spectra lasers are also, which we offer, which are very, very good, will help to reduce your dark spots and complement with a good skincare plan. So hi Saloni, I got a question from her saying what one can use for natural facial bleach. So natural facial bleach is basically when you bleach your face, you're harming your skin because there's a lot of chemical in it. So there is really no remedy for actual natural facial bleach. People use lime on their face to help the bleaching effect. But when you use lime, it's very drying for the face. So it gets sometimes irritated. The pH of the skin becomes acidic. So that really imbalances the skin. So what I suggest my patients is that bleach is done for glowing or for removal of, or making the hair less visible. If there is a lot of hair, there are treatments like laser hair removal offered to patients. And there is bleaching treatments like laser bleaching treatments, which are called as Q-switch lasers, which actually help your hair to look lighter. And over a period of time, it makes the hair also less intense on your skin. So For me, bleaching of any kind is not a very good idea. Of any cream bleach, what I need to say. I have a question from Pankaj Kumar. Hello, ma'am. Good afternoon. Good afternoon, Pankaj. One of my friends is suffering from itching on the body. Can you suggest something? So itching, there are a lot of questions that I would like to ask, but if I would just say in a simple thing, if there is itching and no other body rash on the skin, so there is no fungal infection or anything, and there is generalized itching on the body, I like to start off my patients on a good bath routine, a proper skincare body plan. What is his soap? Is he using one of those neem face soap? Is he using one of those aloe vera soaps? Lime-based soaps. All those are again very dry if he already has dry skin. So try to use a little bit of moisturizing face wash on the body. Then I ask them to not use very hot water, not rub their skin with the towel a lot, and apply with a moisturizer. If the skin is dry and if the itching is because of this dry skin, it actually helps the skin to gets less irritated and less dry, and that reduces the itching. Hi, Mr. Ansari. The question he has asked is, can a sunscreen be used in an acne outburst? Of course, very much. Sunscreen can be used, but the kind of sunscreen that you will pick up is important. So try to pick up a gel-based sunscreens. When my patients have like a really bad acne burst, I would like to stick to like a physical-based sunscreen. So like a plain zinc oxide-based sunscreens I like to give. So it's not very sticky, it's not very oily, and it just gives a nice shield to the face. I also tell them to carry a huge wide brim hat or cover themselves with a scarf is what I suggest. Only for that small initial period when there is so much of acne and so much of infection on the face. I've got a question from Mr. Chirag. My wife has many acne. When she uses acne products, acne disappears. And when she stops products, once again acne comes. So please suggest what I can do. Hi, Mr. Chirag. So that's what I have tried to explain. The acne creams, the topical creams, work only on this bit. So when you use the cream, this is what it works on. It does not help these glands because the creams cannot penetrate all the way till here. So this gland stimulation happens either hormonal or because of some creams or because of some medications or because of many reasons. So if she's using creams, they help the acne to grow till you apply the cream. But if you want the acne to go permanently or you want to find a proper plan for the acne, it's important to understand what is the acne because of. Does she need to take some oral medications? Does she need to use some treatments to clean the oil glands? So it's not just creams that can help. So what I like to do is that if a teenager is suffering from very mild acne and he doesn't have a very bad history of family history of acne, then I would like to give the cream to that small boy or girl and tell him to use it every night so that I don't have to put them on very oral medications, and they can go through this so many years of not having to deal with so much of acne on their forehead. I've got a question from Mr. Vinay saying, good afternoon, doctor. Please suggest any good hair fall shampoo. Hair fall shampoo. Shampoo for hair fall would be, again, a less chemical free, SLS free, paraben free shampoo is what you should look for, and some peptide based shampoos. There are newer shampoos which have come in the market which have peptides in it, which help to actually stimulate your hair. Concurrently, you also have to follow a good hair care plan, some sprays like Capexil molecule sprays, or you have to have, we follow this hair fluence therapy, which is basically nutritional therapy for hair, which we give to our patients. It's a very good program We make them do it for 6 months. They're just vitamins, no side effects. We see a lot of hair regrowth. And I also like to tell my patients to do blood tests and come to me. So the routine blood tests we do for hair, which are very important, are your serum B12, your serum vitamin D3, your serum ferritin, a thyroid profile. So these tests are extremely important for a patient with hair fall. On top of that, whatever a patient's requirement is, we give. And what is the diet of the patient? So like your protein, how is your protein in your diet? Are you taking enough protein? Are you eating enough green leafy vegetables? Have you included nuts, seeds in your diet? So these are the few things which you can do. I have a question from Mr. Sham. Hello, doctor. Suggest how to reduce acne spots. So those are called as acne spots or acne marks. So these acne spots, actually, it's interesting. I'd like to tell you something that because a lot of people suffer from acne spots. The best way to avoid acne spots on your face is to avoid touching your acne. So there are patients who like to keep pricking acne. It's called as acne scory, where they like to burst their acne. They like to prick it because they don't like to see it. If you touch your acne and if you try to break it, that is when you get the spots on your acne. And I like to tell my patients, acne would go, but the spots are very difficult to treat. So don't touch your acne. If you want to get rid of it, you need to either use creams or do treatments. They are not going to go with you breaking them. They're just going to leave more marks. Now for these spots, you can apply. First, if you have acne spots, sunscreen is a must. Sebamed sun spray is very nice actually for back and chest. It's a spray, so it's very easy to just spray on your back and on your face. Also, what I like to give for those spots are kojic acid. So kojic acid is one of my favorite molecule, even azelaic acid. So azelaic acid has an anti-inflammatory, antimicrobial, anti-PIH it works on. So, my patients don't have to use 4 or 5 creams. They get fed up of using so many creams. So what I would like to suggest for you is that if you have acne spots, pick up like an azelaic based cream. So I like the Sesderma Azelaic RU. I'm not supposed to mention brand names, but I know you like to get few brands, so I'm just mentioning some. Azelaic RU, Sesderma, and even Aziderm is very nice, 10%. So what I tell my patients, apply for 2 hours and wash it off. It really helps the marks. I have a next question from Mr. Sachin. Hello, ma'am. As we are on a field work, how can we protect our skin from sun rays and what kind of sunscreen we should use? So, hi, Mr. Sachin. If you're in a field work and you're out in the sun a lot, try to use a sunscreen and try to wear a white, like a hat or a cap or sunglasses so that you don't develop dark circles from the sun rays, and sunscreen. So 2 types of sunscreens. You can pick up a plain physical sunscreen like having only zinc oxide, or a physical and a chemical based sunscreen. If you're in the field work and you have a lot of sun exposure, stick to like a good gel based sunscreen. There are these sunscreens which are available which protect you even from the environmental pollutions and infrared radiation. So these are newer sunscreens which have come in the market, which are also very good. So you can try one of those. Again, as I said, Sebamed sun spray is very good. La Shield IR is very good. And there's one called as Avene Day Protector Cream. So there are these newer based sunscreens which have come, which are set to protect you from the sun and also from the environmental pollution, which is so much in our city. Hi, Mr. Pankaj Kumar. In summer, can we apply baby lotion on baby skin? In the summer, for the baby skin, yes, you can apply a baby lotion for a baby skin. So what I suggest to my patients is that once you give them a bath and you wipe them, dab them dry, you can apply like a very baby lotion. So it has to be not one of those very sticky, creamy base moisturizers. You can apply like a baby lotion on the body. Once or twice is enough for the child. If the child has very dry skin, then you can apply 3 times. To avoid the dry skin of the baby, in the summers, do not wrap up the baby too much because that makes them get a lot of heat boils. I have a question from Miss Zinat. Hi, Miss Zinat. Can you suggest me tips to remove acne from cheeks? To remove acne from cheeks is few tips. One, know what is the cause of acne. Look into your cosmetic bag and see if you're using any cosmetics which are too old, or the brushes have got spoiled, or any of those things. Try to do that. Don't use if you go to the gym, make sure your towels are not dirty. Your towels are not kept at the same side as your gym instruments, because that also attracts a lot of bacteria, and then the same towel you're putting on your face all the time. I advise my patients not to use those wristbands because they look super cool, but every time when you wipe your face with that wristband which is there, it attracts so much of bacteria. And even for some kids who play a lot of like games, they keep wiping their face with their shoulder, with their t-shirt, and that also can cause acne. So if you have these acne on the cheeks, you can avoid these things. Now, what are the tips to help you to remove? Use a good face wash, what I had mentioned earlier. Use acne creams depending upon what kind of acne you have. My favorite is an azelaic acid based cream. And consult a dermatologist to know exactly, give you a good skincare plan for your acne. It's very easy to treat, but you need to understand there are a few tips to pick up when you go to a dermatologist. They can really help you out. The next question is from Vipasha. Hi Vipasha. I have a 3-year-old who loves to play outdoors. How do I take care to prevent tanning? So for a 3-year-old, let them enjoy the sun. You don't need to apply a lot of sunscreen on their hands and the legs. Let them get the sun rays. It's important for them to get the D3. The tan is very superficial. It's going to go off. They're not going to get a tan permanently. Yes, on the face, you could use a sunscreen. You get these sunscreens for children. There are specific sunscreens available for babies. Kindly don't use what sunscreen you are using on the 3-year-old, because I like to give my 3-year-old only a physical sunscreen. So look in when you go to buy a sunscreen, find out, is it got only zinc oxide? That's what you should pick up. A zinc oxide based sunscreen, which is like maybe Suncross Soft is very nice. It's for small children. So if not any of these brands, look for a brand which has only zinc oxide. It's very safe for children from 2 years onwards to use. Absolutely no problem on the face. Let them get the sun on the hands and legs. That's what I would like to tell. So that's all what I could tell you. I tried to talk a lot about different things, but also about acne and acne marks, acne scars, and some tips about acne. So in our clinic, we actually get a lot of patients for acne, and patients are very happy. Acne is something I really don't like my patients to have. I have patients who say that their self-confidence gets reduced because of acne, and that's something which I would like to give my patients their results so that they are happy, and so that's what we love to do in our clinic. There's another question that I have got from Sheetal. Hi Sheetal. I have dry scalp due to which I get flaking a lot. So if you have a dry scalp, that is very important to not have very hot shower. So avoid hot showers. Don't let that hot water fall on your scalp and on your face. You can let it fall on your body if you like, but avoid it to fall directly on your hair. And avoid very long showers. Avoid very chemical-based shampoos. Try an SLS, free SLS. Organic shampoos are available now. SLS and paraben-free shampoos are available, which are very gentle to the scalp. Use a normal base shampoo of yours, should be one of these days, and then once a week or twice a week, complement it with a dedicated anti-dandruff shampoo like a ketoconazole base or a clombazole base shampoo. So the trick is, use your normal shampoo, wash off your hair, take a little bit of the anti-dandruff, put it in your scalp and not on your hair so that it doesn't leave the hair dry, only on the scalp. Wait for 5 minutes and wash it off. So what does that do? That basically helps to clean your scalp, not make your hair very dry, because I have patients who say, well, we use anti-dandruff shampoo, it makes the scalp fine, but it leaves my hair very dry. So that's what I try to tell them, that it's only meant for your scalp. Don't wash your whole hair with it. So that really helps to keep the scalp less dry. But I have a question from Shrishti. Please suggest a good eye cream for newly developed dark circles. So, hi Shrishti. Eye creams for dark circles. So, quick review, some stuff about dark circles. You can have actual pigmentation on dark circles, or you can have fine lines on below your eyes, or you can have an actual depression. If you have had newly dark circles and if you've lost a lot of weight, that's because of the actual hollowing of your eyes. So that is what the hollowing of the eyes will require some kind of treatments like of fillers, which we help to put below the eyes, inject below the eyes. It's very safe, US FDA approved, so they will avoid the hollowing of the eyes. The darkening of the eyes actually is pigmentation around the eyes. So for those, you can pick up creams which have glycolic acid. Again, kojic acid creams are available. Then there is this hazel extract creams which are very nice. Witch hazel creams which contain witch hazel creams are very nice. For dark circle creams, pick up like a retinol based creams. So retinol helps also to remove fine lines and wrinkles. So for brightening, you can pick up a cream with kojic acid in it. For anti-aging, pick up a cream with retinol in it, like my favorite being Retis's eye cream. And for the actual hollowing, you have to use you have to do some surgical, like a intervention, because that's not going to go with only creams, right? So yes, guys, this is all I can talk about. So thanks a lot, and I hope it was educative. I tried to be innovative by putting some charts, giving you some kind of a visual to see the acne. And see you guys. And so you have, my clinic is at South Mumbai, and we can always, if you have any queries, you can still leave them, and I will try to answer most of them. Bye.